Well, good afternoon. Before we end the week, I wanted to provide an update to the people of Iowa on the status of our COVID-19 response. Just 5 days ago, we learned of Iowa's first positive case of the coronavirus. On that day, I upgraded the status of the State Emergency Operations Center, or SEOC, from partial to full activation. The following day, I signed a proclamation of disaster emergency authorizing state agencies to utilize all resources necessary to prevent, contain, and mitigate the effects of COVID-19 virus. And throughout the week, we have assembled teams to address the immediate public health needs and protect the people of the great state of Iowa. We just wrapped up a 2-hour session at SEOC with leaders from several key state agencies about community mitigation strategies to reduce the risk to Iowans and contain the spread of the virus. I want to thank the leaders with me today, and especially their teams, for the incredible effort and teamwork demonstrated over the last several days. As we prepare for what's ahead, I'm confident that we have the right people in place to do the job. Today, I am pleased to share some good news. As we speak, 10 of the Iowans who were quarantined on the Grand Princess cruise in California will be home tonight, and we are working to bring the remaining 10 Iowans home tomorrow. This afternoon, we were also notified of one additional Iowan who tested positive for COVID-19. This individual was tested in Nebraska, but is a resident of Harrison County. All 22 of the tests completed today at the State Hygienic Lab were negative. That brings the total number of Iowans infected with the virus to 17. All 17 positive cases are travel-related, and 15 are directly linked to the same Egyptian cruise. At this time, Iowa is not experiencing community spread of the virus. However, we anticipate it will happen, and now is the time to prepare. This week, state agencies notified their employees about new work-related travel restrictions and guidance for personal travel. At this time, we are ceasing all non-essential business travel by state employees. We are also asking that employees speak with their supervisor and follow the guidance of the CDC regarding their personal travel. If a state employee travels to an affected area, they will be expected to self-isolate at home for 14 days before they return to work. Now is the time to dramatically reduce our risk and to slow the spread of the virus so that we can continue to mitigate it. But we must be responsible about the decisions that we make to do that. If made too soon, some decisions may have serious consequences for Iowa families, businesses, and communities. For example, yesterday, the Department of Education issued guidance for Iowa's K-12 schools. Now is the time for schools to be putting their plans in place for when community spread occurs. The Department of Public Health and the Department of Education do not recommend closing schools at this time. Please know that the Department of Public Health and the Department of Education are here to help you when the time does come, or if you have questions, don't hesitate to reach out to them. Now is the time for a measured and responsible approach. This afternoon, the President declared a national emergency and announced $50 billion in federal aid. He also asked all states to work together and to do their part to help slow the spread of the virus across the country. That's been the focus of our discussion and planning here today. We're coordinating our plans and our resources and reaching out to businesses, healthcare, and other partners to be part of Iowa's strategy to, again, slow down the spread of COVID-19. Next week, we are including leaders from Iowa's healthcare systems at the SEOC. We will meet with them to discuss and coordinate plans for resources and staffing needs in our hospitals, clinics, and other healthcare facilities across the state. But our mitigation efforts extend beyond the walls of SEOC. I want Iowans to know that they also are a very important part of our strategy to stop the spread of the coronavirus. Just like cold, flu, and other more common strains of coronavirus, COVID-19 is spread through transmission of droplets. It's easily passed from one person to the next. And because COVID-19 is a new coronavirus, our bodies don't have the immunity to it, and there are no vaccines at this time to prevent it. And that is why the virus has spread so quickly to a worldwide pandemic level. Every Iowan can make a real difference by reducing our risk for community spread. We must be vigilant about simple, common sense precautions. Wash your hands frequently, coughs, sneezes, cover sneezes and coughs, and if you have any signs of illness, please stay home. Don't go to work, school, or out in public when you could be in close proximity to others. And most importantly, if you are feeling the symptoms, we ask that you call the doctor first before going in for an appointment, and they will walk you through an assessment and help decide what are the appropriate actions to take. As you're going to probably hear Dr. Pedati say, this sounds simple, but these are the steps that really will protect your health and the health of all Iowans. And I cannot stress enough that COVID-19 poses the most risk to older adults above the age of 60, and especially those with underlying health conditions such as heart disease, lung disease, and diabetes. If this describes you or a loved one, we again urge you to take extra precautions. The CDC recommends you avoid large public events and crowded places, avoid cruise travel and non-essential air travel, stay home as much as possible if there is an outbreak in your community, keep some space between yourself and others when you are out, stay away from people who are sick, and of course, wash your hands often, cover cough and sneezes, and stay home when you're sick. Finally, next week is spring break for many schools, and Iowa families will be going on vacation. Please know the COVID-19 status in the area where you are traveling. You can find the most up-to-date travel information and restrictions on the CDC website at cdc.gov. And if you are in an affected area, I urge you to self-isolate at home for 14 days, as recommended, to monitor your health and to, again, prevent the spread of the coronavirus to your classmates, coworkers, friends, and neighbors, and your fellow Iowans. Be safe and be responsible. With that, I'd like to invite Dr. Pedati to provide more detail about community spread and some of the guidance issued this week by the Department of Public Health. But before she does that, I want to just acknowledge again the tremendous work that she and her team and all of the people standing behind me today have done in these past 5 days. We are very grateful and just really appreciate the job that you're doing. With that, I'll turn it over to Dr. Pedati.
Thank you very much, Governor Reynolds. I really appreciate the opportunity to continue to talk with Iowans about public health, about ways to prevent the spread of this virus, and today a bit more about what we call mitigation strategies. As the case counts in our state increase, it's completely understandable that the concern would increase. It's important to keep in mind that at this point we have not yet recognized community spread here in Iowa. Community spread happens when the virus starts to be transmitted among people who haven't been exposed to a known risk factor or to a confirmed case. So in other words, this is when an individual becomes sick with COVID-19 but isn't sure how they would have gotten it. Across the country, and including here in Iowa, local, state, and federal public health disease detectives are continuing to conduct thorough investigations and follow up with contacts of each positive case. When that happens, the kind of things we're doing are asking about travel information and who somebody might have been in contact with to determine first how they may have gotten sick. We also examine whether that individual could have potentially exposed anybody else while they were sick. And anybody who is determined to be a close contact of a known case is then contacted by public health. After that, we provide advice on the next steps that they need to take to keep themselves healthy as well as their communities and families. These steps largely include limiting their interactions and putting more space between people, which is something we also refer to as social distancing. We understand that there are a lot of questions right now about what social distancing means, as well as about mass gatherings, and IDPH has been and will continue to provide guidance on this. Along with our federal partners at the CDC, we're also providing guidance for high-risk groups, particularly when it comes to mass gatherings. For example, emphasizing the restrictions around long-term care facility visits. We also want to note that older adults, again, and those with chronic health conditions should stay away from others who are sick and limit close contact, avoid crowds, and wash their hands often. We're also going to continue to recommend that event organizers prepare as well. They need to ensure that they have contingency plans in place should the need arise. We understand that this can be difficult because things have been changing quickly and they're likely to continue to change. And even with strategies in place to slow the spread of this virus, it is likely that we will see more positive cases. And as we continue to investigate these cases, if public health reveals that there's a new positive case that can't be linked to a known risk factor, like travel on a cruise or a confirmed case, this will indicate that there's spread of the virus in our community. And when we see community spread, we're going to use proven public health measures and make recommendations to help people reduce personal interactions and focus on things like social distancing. So to help slow the spread of the virus, we're going to recommend things like mitigation strategies. And so this is probably what you've heard of when you hear people refer to things like flattening the curve. The idea here is that what we're going to do is slow the spread of a virus to help limit or help reduce the likelihood of a rapid spike in cases. Slowing down and spreading out transmission of a virus is then going to allow all of our critical partners, which include people like hospital personnel, police, EMS, drug manufacturers, and more, that they have a little bit more time to help respond. It also helps keep our systems from becoming overwhelmed at once so that we can maintain sufficient hospital beds, staff, and supplies as we need them. In addition to focusing on slowing the spreading of this disease, we also want to protect our high-risk populations. Again, doing things like avoiding close contact with others and staying home when you're sick are especially important in this time before we have a vaccine or other therapeutic options available. I want to emphasize that individuals, communities, businesses, and healthcare organizations are all an important part of mitigation strategies. Each community is going to be unique, and the mitigation strategies might vary by the community, what's appropriate for them as they prepare, and whether they're experiencing community spread. Communities are going to continue to make decisions at the local level with support from state and federal public health partners. In addition to sharing more information on mitigation strategies this week, IDPH has provided detailed guidance to healthcare providers, long-term care facilities, and schools to assist in their planning should we see community spread. Depending on the level of community spread that we could see, local and state public health departments might need to implement additional mitigation strategies. And so as you heard, going forward, we're going to continue to closely follow contact tracing of these cases to understand the spread of this disease. IDPH also continues to maintain an extensive call center operation that's going to include our disease detectives or epidemiologists who are providing support to public health and clinicians throughout Iowa. We also have a call center, as you've heard, for Iowans who have questions. This is our 211 number that allows Iowans to call in and get basic information about COVID-19 and where to learn more. Our operators will talk with Iowans about items such as what COVID-19 is, how it's transmitted, and what they can do to protect themselves. We want to encourage the public to stay tuned to messages from public health. We're updating our COVID-19 webpage at IDPH throughout the day and providing frequent news releases and briefings. And as I say each time I get the opportunity, whether it comes to seasonal flu or now COVID-19, we really want to encourage Iowans to stay home when you're sick, cover your cough, and wash your hands. We all have a role to play in reducing the spread and impact of this virus. Our number one priority is to reduce the impact of this virus here in Iowa as much as possible, and we're going to continue to work toward this with our many partners at the local, state, and federal level. Thank you.
Thank you, Dr. Pedati. With that, we'll open it up to questions.
In addition to no business travel, have you directed state agencies to hold meetings telephonically? Several of your boards and commissions have recently issued agendas and said they will be meeting in that method rather than face-to-face.
Yeah, we are doing that. That was part of the discussion that we had today. It'll be a continued discussion that we have on Monday at CEOC to look who can telework and how we can proceed forward with normal business, but do it through telecommunication. So those are all practices that each agency is reviewing and working with their respective employees and boards and how they can implement that.
Do we know if this new case in Harrison County is connected to that one in Potawatomi County?
The cases are both related to travel. They're not related to the same travel event or each other.
But they do have a tie back to an event.
People that are calling the 211 number are saying that they're being told they need to have symptoms for 14 days before they can get a test. Can you talk about that and what exactly are testing to get a test or before they can get tested?
Yeah, I think that's a great question, and I know that there's been a lot of changes and questions around testing in particular. So the 14-day piece, I think, really refers to what we would consider sort of an incubation period. So that's not so much a requirement for duration. It's just what we think about when we think about sort of the time frame in which the virus might potentially incubate or be there before somebody would show symptoms. So that's not quite tied to testing. Whenever we think about testing for any reason, though, we always want to make sure that we're being prudent and testing the right patient at the right time. And so, we do want to make sure that we're testing people who have consistent signs and symptoms and who their clinicians evaluate and feel that it's appropriate. And so we've been working and will continue to work with our clinicians to offer testing. In fact, we now do that electronically through the State Hygienic Laboratory to help speed that process.
Do you have enough testing in the state right now to be able to distribute to those who need that?
We do. I feel that we're confident with the testing that we have right now, and from every indication that we've received from the administration as we bring on the private sector, those numbers are going to continue to increase, especially with the changes that the president talked about in the press conference that he just did. We'll continue to monitor it, but right now, we are okay.
Governor, you talk about that community spread is seemingly inevitable, though you don't have that case right now. Why not close schools down, keep people from the Capitol if you're trying to do everything to mitigate this ahead of time? Just explain that logic to people.
Yeah.
If people are concerned, why not do that?
So if you look up here at the graph, we're trying to avoid hitting a peak and really crashing our public health system. And so we're trying to mitigate that. If we do it too early, all we do is move that peak out a little bit further. So we need to base it on data. We need to be prepared to take action once we hit that the community spread or the triggers that would identify that. But what we're trying to do is to push that out, bend the curve, and really manage and mitigate this as we move through it.
But Dr. Pedati, you said avoid close contact with people. I mean, at the State House, in classrooms, I mean, this is like
But
very
if-
close quarters.
But if you're sick, so we're saying there's some simple things that all Iowans can do, and then I'll let Dr. Pedati answer that. If you're sick, stay home. If you're a vulnerable population with underlying conditions, don't go to large crowds, don't go to big events. If you have a cold, take the precautions that you need to be taking. We all have a role to play, but we want to make sure, we want to keep business open, and we want to make sure that we're protecting the health and well-being of Iowans, but we also want to make sure that we're doing what we can to be responsive and mitigating our approach, and that we're keeping business and normal activity going as much as possible.
Yeah, and I would just say, I appreciate the question about, the timing of things. And again, the decisions to do these sorts of things are not decisions that we take lightly. And so we do look, very closely for disease activity in the community as a way to help us make a thoughtful and well-planned decision, because we know that when we ask people to do things like staying home and not going to work or not going to school, we know that those aren't small things to ask of people. And so, we really want to be thoughtful and make sure that we're using the right indicators to make those recommendations. And they may be different in different communities.
Can you explain the difference in thinking between states? I know Iowa has to take care of Iowa, but there are some states with fewer cases and no community spread, and they are shutting things down on a larger scale. And I'm just interested in talk about that.
Well, as it's an evolving situation, and it changes sometimes by the hour and by the day, and so we're trying to be consistent in the data that we're collecting, so we make responsible, reasonable decisions to really mitigate the spread and contain it as much as we can. And so we're doing that, and I think the more that we're able to implement some of the opportunities that the president talked about in the press conference, it will also help us identify, increase the number of people that we can test, make it more accessible. So I think every day we're learning more, and we'll continue to assess and make decisions going forward. The big, one of the things that both Dr. Pedati and I talked about is we just need to be prepared. And so I'm very appreciative of the Department of Public Health, the Department of Education, and honestly, all of my agencies up here, the Department of Human Services. They've put a lot of standards and protocols in place to help the various businesses and schools and daycares walk through what they need to be looking for, what they need to be assessing. If they have workforce that are sick or vulnerable, they need to be sure that they know that they should and can stay home. But we have to be working on contingency plans as we're working through this. Daycare, what do we do with the kids if we do have to shut down school? So we're managing all of that and trying to mitigate how we move through that and do it in a responsible manner. You know, I don't know what they're making their decisions on, and I'm going to stand here and evaluate. We do a weekly call with the vice president. That's been very helpful to really coordinate and talk about what some of the other states are doing, what they're experiencing. That's a valuable lesson, especially some of the 4 states that have been impacted, you know, at a higher rate than we have. We're able to visit with them and talk about some of the things that they've done and how we can implement them in our states. But that's a decision that they have to make, and we're working with our Department of Public Health, who's working closely with the CDC, and we'll continue to manage and mitigate the situation based on the data that we have. Dr. Pedati, do you have anything to add to that?
No, I would just say, you know, again, when we talk about mitigation strategies, you look at a variety of factors, right? You look at spread in a community, you look at how big is a community, you look at what are the community resources available, what's the support from public health and healthcare, and each community has a different sort of assessment to make in looking at those kinds of things.
And I think that's one of the reasons, too, where we're coordinating with healthcare, with our healthcare providers, with our private sector partners, to really talk about some of the logistics and the equipment and the number of beds and how we could start to manage as we move into the next stage.
Governor, could you elaborate on the testing component here? The state hygienic lab, as of this morning, or at least yesterday, said that they had supplies to test just about 150 people. There's some private laboratories that have now stepped in to provide some testing as well. But my understanding is that the state is not tracking exactly how many tests these laboratories are going to be conducting, just that they'll be releasing whether there's positive results. So what kind of information can the public expect in terms of what tests are pending and what information around testing is available?
That's a great question, and you're right. As other testing capabilities become available, the more relevant metric will be positive cases. COVID-19 is a reportable illness here in the state of Iowa, and so those have to be reported immediately to the department by the healthcare provider, and so that's how we receive that information regardless of the laboratory that performs the testing. And as far as the state hygienic laboratory goes, I can share that I was notified even just an hour ago that they have supplies for approximately 850 tests. Again, we're working in very close concert with them, you know, to evaluate their capabilities. And we also want to make sure that we share that it's not just a test. You know, it's also really important, whether we're talking about COVID-19 or any illness, it's really important that we go by how people feel as well, right? If I don't feel well, I can stay home. And if I have sort of a mild cough and a little bit of a fever that responds to Motrin, I can stay at home and sort of recover and follow the guidance we share, which is to stay at home for a certain period of time until your symptoms and fever resolve. And there are some times when that's going to be appropriate, which is why we advise that people reach out to their healthcare providers. So I recognize that there are a lot of questions and concerns around testing, and we're going to continue to work with people on that. But I also want to emphasize it's important just to generally understand that if you have a mild illness, it's appropriate to stay home and reach out to your healthcare provider by phone if you need to.
How do you, when people are only being tested, if they've already been showing symptoms for, you said, some time, how do you assure Iowans that there isn't community spread when it's very likely if they're not getting tested until they've already had the illness for a while, they were spreading it in the community?
Yeah, so part of what we do when we do these investigations, and again, this is sort of routine public health or disease detective work, we ask the individual about what their symptoms were, when they started. We ask them about everything that they did, where they went, who they talked to, where they stood, how long did they talk, what setting were they in. And those are the kinds of questions that we ask to try and understand, what the risk level would be for transmitting illnesses. And depending on the illness, whether it's something else, we ask about those relevant risk factors as well. And so that's kind of how we make an assessment of who we need to reach out to and who we need to talk to. And again, I can tell you that This is part of the work we do all the time in public health, and we are so grateful because we rely on people to pick up the phone when public health calls you and to talk with us and to provide us that information, which is why it's so important, and again, why everybody really does have a role to play in addressing this virus.
Backing on that question, some people can carry the virus if they're not showing any symptoms. So again, to the community spread, how do you really, assuredly say that it's not already in the communities right now? We just don't know.
Yeah, we don't think that people who are asymptomatic are representing a way that this is really passing from person to person. Now, we do continue to learn more about this virus, but as we have learned more, it really is indicating that people who are contagious are the people who are spreading this virus. We're going to continue to follow that. We're going to continue to learn more and share that as we find out more. But that's also why it's just so important for people to pay attention to how they feel, and if you don't feel well, to stay home and stay away from other people, particularly our high-risk groups.
So this graph talks about, that line that says how many very sick people hospitals can treat. Do you have a number that you'll be able to share with us, as in how many hospital beds are available in the state? What's the max capacity?
That's information that we do keep track of. I don't have that available right now, but it is information that we look at.
And it is what they are looking at, and that's part of the pre-pandemic assessment that we were talking about, to just understand the number of beds, the number of resources, logistics, equipment. And again, it'll be helpful to bring all of our healthcare affiliates to SEOC on Monday, and that'll continue the conversation and the coordination so that we are prepared to address those questions going forward.
Is the University of Iowa working on a test on its own?
I'm not aware of that. Are you?
It might be best to
Ask them.
follow up.
Yeah, I'm not sure.
Governor, there's some individuals that are offering sort of anecdotal experiences about claiming that they have had interactions with people who may have been linked to this cruise in Egypt, and are claiming that they have tried to reach out to state public health officials about concerns in terms of interactions. Is there any particular message that you have for individuals who are claiming, that they have concerns that maybe this thing is spreading?
Yeah, I would ask them to go ahead and to please continue to reach out to the Department of Public Health. They can talk to their doctor, or because they also have the capability of doing a pre-assessment and can advise them on next steps. But I want to commend the work that the department has done in reaching out through the 211 and through their office in providing protocol and reaching out to individuals to provide them the assessment that they need. But they can also reach out to their physicians as well.
Governor, when you walked in, the Iowa Business Council was canceling an event. The Des Moines Symphony has canceled concerts. Are you asking people to rethink this, since you're not discouraging people from gathering in large groups?
Those are decisions that they'll have to make, but what we're saying is if you're unsure what to do, you have a great resource with the Department of Public Health, that they have standards and protocols in place that they would be happy to walk through you with. They've sent out several to schools and businesses and healthcare facilities, nursing homes, long-term care facilities. But again, it's just people have to be responsible, as Dr. Pedati said. If you're not feeling well, you shouldn't attend a large event. If you are a vulnerable Iowan, a senior with underlying conditions, you should not attend large events. But as we move through this and as we learn more and as we reassess, it is evolving every day. And so we'll be reassessing on a daily basis, and, the recommendations may change going forward. But right now, we're going to base it on an incident-by-incident decisions on what we're seeing come in.
Last question.
What about daycare? I know that's a question that a lot of people are having. What are you guys actively working on if schools do start closing? Parents have to still probably go to work. What do they do with their children?
Yeah, so those are some of the issues that we're addressing. We're working especially with our healthcare professionals and our workforce to make sure that we have backup healthcare. So those are some of the issues that we're working with as we work with not only businesses but with the schools and healthcare as well.
Thanks, everyone.